today, so I'm going to provide for privacy, and I will perform hand hygiene. I'm Nicole. I'll be your nurse today. Can you please tell me your name and date of birth?
Terrence Shipman, April 29th, 1970.
Okay, Mr. Shipman. So the doctor has ordered for a Foley catheter to be inserted into your bladder. So I'm just going to feel around your abdomen right now, and then we'll go ahead and get started. So I'm just going to let down your head just a little bit. Let me pull back your sheet, and I'm going to pull up your gown. And right now I'm palpating the bladder, or I could also use a bladder scanner. Okay, Mr. Shipman, I'm going to go ahead and get my supplies, and then we can go ahead and get started. So I'm going to perform hand hygiene and go grab my supplies. Perform hand hygiene, and then I'm going to put on gloves. Okay, Mr. Shipman, I'm going to go ahead and cover you. Okay, I'm going to expose you a little bit here. Okay, great. Okay, so I'm going to inspect for any redness. Okay, and I'm going to check the urinary meatus. Go ahead and get cleaned up. And I'm going to dispose of my gloves and wash my hands. Lubrication. Okay, Mr. Shipman, I'm going to go ahead and clean the area. It may be a little cold, so just bear with me. Okay. Okay, I'm going to lubricate the catheter about 5 to 7 inches. Okay. I'm going to insert the catheter about 7 to 9 inches. Okay, and I'm going to pull on the catheter till I meet resistance from the inflated tubing, the inflated balloon. Okay. Perform hand hygiene. And I'm going to put on a new pair of gloves. Okay. So now I'm going to clean everything. Okay, I'm going to secure the tubing to the patient's upper thigh. And I will connect the bag to the bed frame below the patient's bladder. And then I will clamp the tubing to the patient's sheet. Okay, I'm going to throw away my gloves, perform hand hygiene. Okay, Mr. Shipman, now there's a couple of things that I want to talk to you about as far as the catheter. So we want to make sure that we keep it clean in the insertion area. And also, you definitely do not want to pull on the catheter. And if you do end up standing up or walking around, you want to make sure the tubing is secure to your inner thigh. Now, can you please repeat those things back to me so I know that you understood?
Keep area clean. Don't pull on tube.
Thank you. That's great. So do you have any more questions? Okay. So I'm going to go ahead and raise the bed back to level. Raise your head up. Give you your call light, toilet paper if you need it. And I'll be back to check on you. Have a good day.